Welcome to the Scientific Sense podcast, where we explore emerging ideas from science, policy, economics, and technology. My name is Gill Eapen. We talk with world's leading academics and experts about their recent research or general areas of topical interest. Scientific Sense is an unstructured conversation with no agenda or preparation. We cover a wide variety of domains where new discoveries are made and new technologies are developed on a daily basis. We are most interested in how new ideas affect society and help educate the world how to pursue a rewarding and enjoyable life rooted in science, logic, and information. We seek knowledge without boundaries or constraints and provide unedited content of conversations with researchers and leaders who love what they do. A companion blog to this podcast can be found at scientificsense.com, and this podcast is available on over a dozen platforms and directly at scientificsense.net. If you have suggestions for topics, guests, and other ideas, please send them to info@scientificsense.com, and I can be reached at gill@eapen.info. My guest today is Jeanne Bonds, who is a professor of the practice Impact Investment and Sustainable Finance at the Kenan-Flagler Business School at the University of North Carolina in Chapel Hill. Jeanne is a former leader in regional community development for the Federal Reserve Bank of Richmond. In her previous role, she provided leadership for strategic stakeholder collaboration and community-level solutions, focusing on low and moderate income and underserved communities in support of the Federal Reserve System's community development function. Welcome, Jeanne.
Thank you. Great to be here with you.
You are involved in a project at the Kenan Charitable Trust on whole community health. And you say that the consequences of historical policies and practices have produced and perpetuated socioeconomic inequities. Entrenched disparities do not exist in isolation and cannot be solved piecemeal. Instead, a more integrated and sustainable approach is required. Could you describe a bit what you mean by whole community health?
Yes, absolutely. So, whole community health is really based on an understanding of the social determinants of health, which really looks at health outcomes and health behaviors, but all of the inputs that go into those determinations. So, environmental justice issues, issues with safe housing, issues with public safety in general, individuals' financial stability, all of those various factors that you think of in terms of quality of life that together determine what may happen with someone as far as their health outcomes. So that's how we typically describe whole community health.
Okay, so if you think about this sort of a system, the output that you're measuring is the health outcome. So this is essentially quality of life years that an individual gets, and then into the box goes variety of attributes, right?
Yes.
Okay, and those attributes span many different things: education, access to nutrition. What are the primary attributes that go into it?
Well, so generally, a good place for your listeners to take a look at this would be the Robert Wood Johnson Foundation. They actually do a ranking by each county in the United States, looking at those behaviors and those outcomes. Yeah. And they score them based on these other factors. So they look at median family income as an input into that system. They look at what's the rate of home ownership versus rental. What's the quality of the affordable and workforce housing? Is there nearby access to nutritious food, or is it a food desert? Are there environmental hazards with air or water quality? in the area. And it just goes down the list, and they look at the county and they calculate what it looks like within those census blocks, and then they give a rating to the county as a whole.
Yeah, that's so interesting. So it's so, we always talk about how much healthcare is costing us. So I think the GDP is in the range of 20 trillion. Healthcare expenses in the US is reaching approximately 4 trillion, so about 20% of the GDP. But what is not really thought through, I think, is healthcare costs could be sort of a symptom of an underlying disease, right? Yeah.
Exactly.
And so we are
Yes, because
yeah, go ahead.
we see in these communities where they don't have nearby access to a healthcare facility, or they don't have the broadband capacity to be able to gain that access to a healthcare facility. So they may have underlying conditions that go untreated. They may not have access to food, and they may have an underlying health condition that could be improved if they had access to better food. So clearly these factors, having a job, having the financial capability, living in that safe housing, the community that's safe, are they isolated? We know that when older people are isolated, and potentially even younger people now with what's going on with the pandemic, that isolation can contribute to health conditions equal to smoking a pack of cigarettes. So if we look at all of those factors and we could improve those factors, then we could improve the health outcomes for individuals. And as you said, potentially save quite a bit of money on the healthcare end.
Yeah, and the other issue we have is we seem to treat physical health and mental health in completely disconnected silos. And this is true for the providers. Obviously, there are different specializations there, but it's also true for payers who seem not to understand how mental health and physical health are so intimately connected. I think this is much well appreciated when you go into community health in a more holistic fashion, right?
Absolutely. One of the things that I think the University of North Carolina at Chapel Hill does well is through the Kenan Charitable Trust generosity, they started looking at interprofessional health
Yeah.
education. And instead of you, a patient in a healthcare facility, and being seen independently by different practitioners in the health fields, they're working to bring those fields together so that you're seen as a collective, and you have the benefit of the mental health professional, the physical health professional, the pharmacist, the nurse, so that is they're working as a team to treat the patients instead of a revolving door of the different professions coming in and out and not collaborating. So that's one element. And then what we did was we wanted to bring interprofessional students from an even broader range together. So we brought in business and law because so many of these other socioeconomic issues could be addressed by
Mhm.
attorneys and business professionals. So we wanted to bring them into the loop with the health professionals so that everyone's looking at the whole picture of someone's health, not just the health care, but all of the inputs that go into what they may need on the healthcare side.
Yeah, yeah, and technology has a major role to play here. It was heartbreaking to see. I saw a story and a picture that, two kids doing their homework by a fast food place to get the Wi-Fi. And, you don't typically expect to see these types of things in a developed country. And so we seem to be falling behind in even sort of tactical interventions. Information is really the key now, right? If you don't have access to information, you're going to be left behind regardless of other attributes that we can focus on.
Absolutely. I mean, it drills down to even libraries. If you look at rural areas in our country, a library may be the size of a single family home. It may be less than 2,000 square
Mhm.
feet. staffed by one person, and they may not even have the catalog of information available in that rural area that you might find in a larger urban library, let alone the broadband access. And then in terms of the broadband access, the country is just a maze of federal, state, and local
Mm.
regulations. So you have to wade your way through the regulations. And then if you can get the access to someone's door, which is the ultimate goal, you have to make sure that it's the right access that enables them to use the services they need. So your broadband won't be any good if it's not fast enough for telehealth during a pandemic or the delivery of educational services. So we really have to be coordinated as to how we work through that regulatory process
Right.
and all of the maze of laws, which again was the reason we wanted to bring business students and law school students in, because a lot of this is based on ordinances, regs, and laws.
Yeah. Yeah. I know that there were some attempts a few years ago to make internet, sort of non-terrestrial and universal. Google had a program based on balloons in Australia or New Zealand. I don't know the status of any of those programs. I think what we have is right now sort of a patchwork, I should say, of ISPs and internet provision with varying speeds. And like you say, some of them are not really capable of delivering telehealth and other type of information. So it seems to me this is sort of a national problem, right? Not just specific areas.
Yeah, it's absolutely a national problem that needs a national solution, just like, you know, people in rural areas didn't have access to electricity, and we addressed that as a country to make sure that we had a department that delivered electric service to everyone. This is very much the same issue, and we need to look at it that way. And the federal government is making incredible investment in the infrastructure through several different departments and agencies. And then, more recently, the FCC made a commitment of around $22 billion, again, to add on to that infrastructure. And there's a bill pending in Congress around the formulas for each state for that. So we're making huge investments in the infrastructure, but it still comes down to who's going to build the infrastructure, and then at the state and local level, do you have barriers in the way? What type of structure do you need to deploy that to get the speed people need? So unfortunately, it's just a very, very slow process. And when something like a pandemic comes along, it doesn't speed that process up. And so we're really as a country just wading through that issue.
Yeah, yeah. I always felt that, we have sort of information-based segregation now. It used to be other attributes, but information has become a very important attribute in segregation. And unless, like you say, unless some kind of national plan to do that, we won't be able to solve that problem. I want to jump into, you have a pilot project going on in yeah, this is in North Carolina, right? Robeson and Edgecombe counties. You want to talk a
Correct.
little bit about that?
Yes, so that's this whole community health process. What we did was the Kenan Charitable Trust wanted to look at system change, which is longer term change, how you really address the root of issues that are holding people and communities back, which is to be applauded because so many philanthropies just give grants that might sustain a community or an entity for a short period of
Hmm.
time. So this is much more about investing in the system change. So what we did was we looked at North Carolina. We have 100 counties in North Carolina, and we looked at the patterns of in migration, out migration, deaths versus births, pulled together, poverty data, per capita income, and we really have about 33 to 36 counties that have not been the recipient of in migration.
Hmm.
Some areas in North Carolina receive 200 people daily from other areas moving
Hmm.
in. But we have a lot of counties that aren't recipients of that. They're they have more people leaving than coming in, and they have more people dying than being born. So they're really dying counties. And along with that goes tax burden, costs of infrastructure like water and sewer with a declining population. So we see higher poverty levels, and we see issues with accessing transportation to get to jobs. So among those counties, we chose two, and we looked at their rankings at that Robert Wood Johnson Foundation Health Rankings, and both Robeson and Edgecombe rank at the bottom of our 100 counties for those health rankings. They're 97 and
Yeah.
100. Um, Edgecombe is a majority minority county, and Robeson is a triracial county with a large Lumbee Nation population, the largest tribal nation that's not fully federally recognized in the
Mm.
country. So those are the two counties that we decided to focus on, and we started this past summer with a group of 16 student interns representing medicine, pharmacy, public health, law, and business, and they started doing a deep dive to come up with a priority of system change mechanisms that we could focus on for the next 3 years.
Yeah. So these two counties are geographically uh, quite apart. Edgecombe, northeast of Raleigh, and then Robeson, southwest of Raleigh. So, but they have some common characteristics, right? So, I was looking at some of the statistics. Um, so Edgecombe lost 4,500 residents in the 2010-2018 time period, and similarly for the other county. And so these are huge losses in terms of people moving out of the county. Are they moving toward the city? But they said what's happening?
Yes. So in both cases, people are moving to other larger cities nearby. Both Robeson and Edgecombe are on the Interstate 95 corridor. They both have a hub city. Edgecombe has Rocky Mount, North Carolina, and Robeson has
Mm.
Lumberton, North Carolina. Those are both on that Interstate 95 corridor. But when people move from those areas, they're moving to the job center. So in Edgecombe, they might be moving towards Greenville, North Carolina, east of there, which is a larger city with a university and a hospital there. They could be moving to Raleigh, which is, we also chose these counties because they're both about an hour and 20 minutes from Chapel Hill.
Okay.
Yeah, yeah, we originally planned for the students to live there before the pandemic came along. And Robeson, they are moving to Fayetteville, which is a larger city nearby, also a large military installation. So, and then Robeson has a unique challenge also that there's UNC Pembroke
Okay.
there, which is our Native American institution, but they have a need for more student and faculty housing. So a lot of their students and faculty come in from other places and then leave at the end of the day.
Yeah, and their racial makeup is different. These counties,
Mm-hmm. Mm-hmm.
as you say, Robeson has a very high percentage of Native American, whereas Edgecombe doesn't at all. But they show similar household median income around $35,000, which appears to be like 70% of North Carolina's average income, right?
Correct. That's correct. They both share that. The home ownership's a little bit higher in Robeson than Edgecombe.
Yeah.
Mm-hmm.
And so when you look at this program, the whole community health program and the model, you have six interconnected pillars of opportunity, you say. And the first one is economic stability, including employment opportunities with living wages and financial education. You want to talk a bit about that?
Sure. Yeah. So, really, what we mean by that is, are there jobs that pay living wages within those counties that can either attract people in migration or employ the people that are located? So, many times you have a business that is incentivized by the state or the local government to come into the community. and the people who work there either come from other areas and they choose to live outside that
Mm.
area, or the business comes in and then people come to work from another area and go back. So, for example, there's a health system in Edgecombe, but many of those doctors and employees of that health system live in another county that's nearby. So, looking at the structure for how economic development's done, and does it really benefit the local population? Does the workforce training, is it compatible with the types of businesses that they're trying to recruit? And then is there an element of homegrown business taking place? Are there support systems that support entrepreneurship in that area?
And what would you consider living wages, Jeannie, in that area?
Well, I mean, there's a pretty, what at a minimum, what we'd want to see is people clearly being paid at least $15 an
Yeah.
hour, well above minimum wage. There is a computation for both places in terms of what they would need to make, as well as the state as a whole, and it is somewhat higher than that.
Mm.
So we'd like to see people be able to sustain themselves with well above minimum wage jobs.
And so, the argument economists often make, even though the data is very sparse around this, is that as the required wages go up, there will be less employment and businesses move out of the area. Do you buy that argument, or do you see alternatives that could be deployed?
Well, I would. I've spent a lifetime working with economists, and I've heard that
Yeah.
argument. Um, so I think what you have to do is you have to look at it in terms of a model of if that's true, but then you have the cost of healthcare and all of these other systems that we're talking about. Is it really less expensive
Mm.
to pay those wages if those businesses end up having to support the other end of that? In terms of safety net support, et cetera. So, I would argue that for the people living there, we have cities across the country that have addressed living wage jobs and have been able to do that. Certainly, when you're in the process of trying to increase your in migration, and the pandemic offers some opportunity for some of these smaller places to be able to attract people into the community. Maybe not so feasible, but it's not feasible to have a single mom with two children working three minimum wage jobs and having a lack of child care. So, our focus is really on the next generation. And what you find are that minority youth and children in both of these communities and many others are hit with this whammy of lack of opportunity because some of these systems hold them back. And one of them is those living wage jobs. That's what causes people to migrate to those other areas.
Yeah, and what makes this project so interesting is that you are measuring health and quality of life, and from a macro perspective, we have largely externalized that $4 trillion in healthcare that we talked about, and so what we haven't done is to assess, if we were to improve like you are doing, the overall welfare of society, what the net impact is going to be on the output, which again is health and quality of life. And so from an investment perspective, these things are kind of considered from a policy perspective in a very disconnected way. And I
Hmm.
think that is where that is why we ended up in this predicament right now, I think.
Absolutely. I think if we assessed a lot of these major federal topics of interest from this more holistic standpoint, we may come up with different determinations than we have in the past, because certainly the healthcare model has shifted towards keeping people out of hospitals. So with that goes those delivery of services outside of the hospital, as well as all these factors that make or keep people healthy. And if they're healthier, they live longer and they may be able to work longer. So, yeah, I think we have to, that's our hope for this project, is that we can look at it a lot more holistically. as we tackle the issues and really find out what those barriers are. Are the barriers within a county? Are there issues with procurement, supply chain diversity that are holding back businesses? There's quite a few cities around the country that when they took a look at their supplier diversity and procurement systems, minority owned businesses were able to grow and gain more employees and pay them better. So it's a very interconnected, um, complex set of topics, but by narrowing it down to two communities that have some investment going on, but many challenges, we're hoping we can unlock some of those models as to how you would think through the solutions.
Yeah. And the second aspect here is education. And I want to go into it. I want to also touch on, you mentioned financial education, which is, I think, often overlooked. Which, somebody with limited resources, there are so many financial products out there that is very confusing, credit cards being one of them. And if you get onto some of these financial products, it's like a black hole. You can never get out of it, right? And
Mm-hmm.
so does the financial education include those types of things?
Oh, absolutely. Education about what factors go into your credit score, how you clean up your credit score, how you address issues around heirs, property, really a lot of the basic financial components that someone, needs to be able to understand to successfully navigate through this world. So many times people feel like if I can't access these products in this traditional sense, well, I'll go online. And they may end up in a situation where their interest rate is changed often, and they're trapped in the situation. I certainly talked to quite a few business owners during the PPP program rollout who had gone to use online providers who then referred them to another online provider who referred them somewhere else. And they were caught in a tangle and not accessing the money that was there and available. So that basic financial acumen that we want our children to learn K through
Hmm.
12, I think we have to emphasize that for some of our adults as well, so that people can navigate financially and know how to make decisions.
Yeah. And you also mentioned vocational training. Um, you want to elaborate on that?
Yes. So we are very fortunate in North Carolina. We have a very strong statewide community college system. We have 58 community colleges that serve the 100 counties. And both of these counties, in particular, we're talking about, have access to really outstanding community colleges. They work with employers on specialized training. They also work with the general population on training that is correlated to the jobs that are most in demand. So, one of the aspects we're looking at with both of these counties is what we call encore um,
Yeah.
employment. So, people who come in that are older and what types of jobs are needed and how we could apply that investment to create jobs in that area. So, workforce training is a huge component of this. And I will say both counties have issues where they have formerly incarcerated
Mhm.
populations, and there's quite a few restrictions on those populations. So, for example, you can't be a barber if you had a certain arrest record or conviction
Yeah.
record. So, there's quite a few things that we'd like to talk to our legislature about testing out the models on some of those barriers.
Okay. Okay. And so it's almost like demand-driven education delivered through community colleges, right? So rather
Yes.
than sort of taking the cookie cutter approach to education, you are saying let's look at what is in demand, and let's provide a platform where people could get that type of education so that they can get employed.
Exactly. And then along with that, the critical skills training to adapt to whatever the next evolution of employment and the labor forces in the US. So just as we're still in the technological revolution and we have machine learning, make sure that people also have those skills that are interchangeable and adaptable.
Right, right. And the third dimension here is food, um, healthy food, and the absence of hunger among at-risk vulnerable population. And I don't know, I think the the people who suffer from hunger in the country, I think, is quite high, right? Do you have a statistic?
I don't have a statistic for off the top of my head around hunger. I know how many people are in poverty in the U.S. And typically, what goes along with that is readily available, nutritious food and access. So, for example, we have 11.6 million children in the country who are in
Mm,
poverty, and and usually what happens in these underserved communities is a lack of access. It's either a lack of transportation access to get to the food or just generally a lack of access to that healthy food. And in many places, these are agricultural
yeah.
areas that have some opportunity around food, but that has not been connected to their economic development system in general. So there's an opportunity to connect the farmers in with those needs, and then also agricultural related products in that area. And there's definitely some federal tools that can be used to drive that investment. And so that's an area I think of concern all across the
Mm.
country.
So the intervention is like food banks and farmers markets and things like that, or what are the specific interventions there?
Well, the specific interventions, certainly in terms of just getting food to people, are food banks,
Yeah,
but that's not necessarily a long term sustainable
right.
solution. So, yeah, the solution would be more towards engaging the agricultural community as small businesses. There's a tool available from the federal government called rural business investment companies that can make
Mm,
investments in ag related businesses. So there's quite a few examples of how you could layer and leverage some opportunity for the business side of it, and then team that up with the people in an area through a food hub as to how you market and use those foods. And then there's some great examples of how community organizations have brought food into their community. There is a community development corporation in a community in North Carolina that bought a building that had been a grocery store and worked with one of the food store chains to start with a small store,
mm,
basically let them use it rent free and start with a small number of products and then gradually build up to it. There's examples of counties that have done that as well. So it's figuring out how you can actually get the food in there, and then how you might be able to create a food system within the community that sustains across agriculture as well as the consumption.
right, right. And the fourth dimension is healthcare. So access to high quality healthcare and well trained providers. I think healthcare in general, I believe one of the issues we have is we don't have sufficient focus on prevention, right? So we have a
Right.
huge, manufacturer industry that is largely focused on treatment once somebody's diagnosed with something. And so both the tools as well as the focus is lacking in prevention. And I think this is probably quite valid for this experiment as well, right?
Oh, yeah, absolutely. Because we have a challenge. So we have a challenge in North Carolina, as in some other states where our state did not choose to take Medicaid expansion. So we have in North Carolina 500,000 people that don't have access because we don't have that Medicaid
Mm,
expansion. So we have that lack of access. We have the cost. And we talked about broadband earlier as being a component of that. And then we have a real challenge with our rural hospitals because of that lack of Medicaid expansion. We've had a number of rural hospitals that closed, or rural hospitals that had specific types of facilities that they had to close. So in Eastern North Carolina, we had a facility that had to close its birthing center.
mm,
And now women have to travel more than 60 miles to another birthing center.
Mm.
To receive that type of care. So telehealth helps, but we have to be able to have access for people to get to some of those types of facilities, and that's been a real challenge with the healthcare equation that we have on hand.
Yeah, and the technology dimension, because you have to prop up the technology infrastructure for that to work as well. Yeah.
Correct. Yes.
And so the fifth one here is social integration and community engagement. And so, again, this is not something that gets a lot of focus on. And you can see in the data that without this type of intervention, it's going to ultimately show up in healthcare. It's just a matter of time.
Right. Right. So that we talked earlier about
Yeah.
isolation. So that the fabric of the community, whether it's access to voting, access to information, easily obtainable information, to what level is the community engaged in these forces or solutions that shape their future. So my colleague and I talk about collective
Mm.
ambition, which is everybody on board? Are they all on the bus? Are they all in a seat? And is the bus heading in the right direction? And it's everybody facing that direction. So how do you build that social participation into the process, so you're not doing it to the community, but rather with the community?
Right. Right. And finally the physical environment, including safe and affordable housing and transportation, but also city planning, right? Green spaces and walkability and those types of things.
Right, right. Especially for populations that have aging demographics. Are there sidewalks? Are there ways for them to maneuver as they age, that adapt to that? Is the community safe? Is the housing of sound and in good shape? I mean, Robeson County has had major challenges with storm after storm and severe flooding. So I can sit here right now and tell you that there are people living in unsafe housing where they have mold issues,
Yeah.
that still have not been addressed. And then, yeah, just the whole concept: are there places for recreation, green spaces? Are there places that were previously environmental issues? Could they be converted to green spaces? All of those factors. Access to quality water is another big component.
Yeah, so this looks like a great experiment, Jeannie. I wondered, there should be comparable counties adjacent to these counties. So do you think we'll get some insights? I mean, you have a control group, so to speak, right? And you have some pre-treatment and post-treatment data coming out of these two counties. Do you think we will get some insights as to what might work and what might not?
Yes, absolutely. So we'll be putting out a paper that focuses on our first findings from the work this summer. And then we actually have a smaller group of interns that are narrowing down to work on a couple of key issues through this fall
Yeah.
semester. But we'll continue to update that data. And as I mentioned, we want to stay focused on these two particular counties for about 3 years to really achieve some sustainable system change, whether it's access to capital, or a solution to housing issues, however we end up prioritizing with the communities, and show that change, and then be able to take this model and be able to replicate it. Because as I mentioned, just in North Carolina, we have 34 other counties that look just like this, some even a little bit worse. So the goal would be, can we replicate it, and can we replicate it more quickly as we go along?
And what is sort of the duration you're thinking about before we can actually see some results?
I think that we have a couple of priority areas that we want to work on in the fall, that have some, very specific outputs. One on housing and one around capital
Yeah.
access. So I'm hopeful that by early next year we will at least have a couple of major changes in place in each place that will start producing some results, but I wouldn't expect us to see, changes in that data immediately.
Okay. Okay. Yeah. So I want to close with, the you're doing such a great work. So you have a set of grant making priorities in the William Kenan Charitable Trust. You want to talk about sort of the overall statistics of the trust, and how you have been executing that.
Well, the trust, I certainly couldn't speak for the trust. They have trustees and management. They've typically, and their annual reports available
Yeah.
online. But they typically give to more than 250
Mhm.
recipients, and they have a focus area that covers New York, Kentucky, North Carolina, and Florida. And I would point to some other great work that they've been doing in Louisville, on the west side of Louisville, in a community called Russell's
Mm.
Promise, which mirrors what we're doing in North Carolina, which is looking at system change. And they've made a large investment in Louisville and have been in that community for a while. So what I will say is we're so thankful to have the Kenan Charitable Trust, and I know Louisville would say the same thing, and that they're really thinking outside the box in terms of what can philanthropy do that really creates change and creates impact from that system level, as opposed to just giving grants. And especially, when you have something like a pandemic going on, you certainly need to be able to give grants to help organizations stay functional. And the Kenan Trust gives a lot to food banks, and other types of intermediaries that work on some of those issues. But I think these are changes in the philanthropic community. And so they're really being leaders in our state and in a region for stepping out and looking at a different way that philanthropy can be a driver to leverage a private sector funding.
Yeah, I'm sure you're working on this. So the paper that might come out of this, it'll be very interesting to see, some sort of an economic analysis, right? So this much investment went into the system. This is going to be sort of the net benefits, and that benefits is not a one-time benefit. It's a long-term benefit, right, accruing to it. And
Hmm.
so, sort of, what's the return on investment question? And I think you are in a good position to look at this. And I haven't seen this, at this level of detail. Looking at all six aspects of that those dimensions that we went through, which is economic stability, education, food, healthy food, uh, high quality healthcare, social integration, and physical environment, and sort of integrating all six of those components. And they have reinforcing effects, I would imagine, right? So we should see a really very high ROI for something like this, I would think.
Absolutely, and hopefully a roadmap
Yeah.
for how to go in and tackle those issues to see that output. And I think for me, because my interest is in sustainable finance, how can you take some dollars and then leverage other dollars in some of these solutions? I think there's been some really interesting work across the country as to how you do that, and we have a new generation, not just of students who want to learn this in a holistic manner, but we have a new generation of investors coming
Yeah.
along, and leaders in the business community who are going to be interested in how to achieve that social impact. So I think that is a huge component of the model as well.
Absolutely. Yeah. So this has been great, Jeannie. Thanks so much for spending time with me, and good luck with everything that you're doing.
Great. Thank you so much. I really appreciate your
Thank
time.